Zinc is one of the most common nutrients included in male fertility supplements. But more zinc doesn't necessarily mean better sperm. This is the Men's Fertility Nutrition Podcast. Practical, evidence-based strategies to support sperm health and fertility outcomes. I'm Alex, Men's Fertility Dietitian. And in this series, we focus on the things men can control to make a real difference. Let's get into it. In the last few episodes, we've been looking at individual nutrients that are commonly recommended for sperm health. And zinc sits right near the top of that list. It's included in most male fertility supplements, it's often tested, and it's frequently positioned as something that men should be taking when trying to conceive. But as with most things in this space, the detail matters. Zinc is an essential nutrient for male reproductive health. It plays a role in spermatogenesis, DNA synthesis and repair, and antioxidant defense that helps protect sperm from oxidative damage. It's also found in relatively high concentrations in seminal fluid, suggesting a direct role in sperm function. Observationally, lower zinc status has been associated with poorer sperm parameters, including reduced count and motility. So on the surface, it makes sense that zinc supplementation might improve male fertility. But that assumption is exactly what we're going to test in this episode. And this is where things start to diverge. Because what makes sense biologically doesn't always translate into meaningful clinical outcomes. Some smaller studies have explored zinc supplementation either on its own or in combination with folic acid. A few have reported changes in sperm parameters like concentration or morphology. But these studies are typically small, use different doses and durations, and are not always conducted in infertile populations. And importantly, changes in sperm parameters don't necessarily translate to improved fertility outcomes. When this question's been tested at a larger scale, the results are less convincing. A large 2020 randomised controlled trial looked at folic acid and zinc supplementation in over 2,000 men undergoing fertility treatment. The study found no improvement in semen parameters, no reduction in DNA fragmentation, and no improvement in pregnancy or live birth rates. So while earlier studies suggested there might be some signal, higher quality evidence doesn't support zinc supplementation as a reliable way to improve fertility outcomes. And this is where the nuance matters. Zinc is essential for normal sperm production, but correcting a deficiency is very different from supplementing an already adequate system. If zinc intake or status is low, bringing that back into an adequate range may support sperm health. But in men who are already meeting their requirements, adding more zinc doesn't appear to provide additional benefit. So rather than being a default supplement, zinc is better thought of as something to use in the right context. Zinc can be tested, but the test itself has limitations. Blood levels don't always reflect what's happening at a tissue level, and they're influenced by factors like recent food intake, time of the day, and inflammation. So while testing can be useful in some situations, it's only one piece of the picture. It's easy to focus on a single nutrient or a single test result and try to build everything around that. But nutrients like zinc don't operate in isolation. They sit within a broader dietary pattern, alongside total energy intake, protein intake, and other key micronutrients that all contribute to sperm production. So in practice, the goal isn't to just optimise one number. It's to assess whether the key inputs required for sperm health are consistently in place. And that usually requires a more comprehensive look at diet, lifestyle, and any available testing together. So stepping back, What does this mean in practice? Zinc is an important nutrient for sperm production, and making sure it's adequate is part of a solid foundation. But if zinc intake or status are low, correcting that may support sperm health. But more isn't necessarily better, and supplementation isn't a reliable way to improve fertility outcomes in men who are already meeting their requirements. The focus is on getting the fundamentals right first. A consistent dietary pattern that provides enough total energy, adequate protein, and key micronutrients from foods like meat, seafood, dairy, nuts, legumes, and whole grains to support sperm development over time. And the best starting point is looking at whether your diet regularly includes these type of zinc-rich foods. Before I wrap up, this podcast is for general education and doesn't replace personalised medical or nutrition advice. If you have specific concerns, it's important to speak with your doctor or a qualified health professional. I hope this episode has helped to clarify where zinc fits. Important to correct when low, but not a standalone solution. If this episode has helped clarify things, make sure you're following the show so you don't miss what comes next. In the next episode, we'll take another step back from individual nutrients and look at the bigger picture. What a fertility supportive diet actually looks like in practice. If you and your partner are trying to conceive and would like individualised support, I work with men and couples across Australia via telehealth. You can learn more or book a sperm health assessment at accessdietetics.com. Thanks for listening.